Hey everybody, thank you so much for joining Sarah and I on this Pause the Panic event. I know there's a lot going on in the world and it can be really frightening. So we're here to talk a little bit about COVID and give you our general do's and don'ts and some key messages because we know there's a lot of information out there. So just by way of introduction, my name is Dr. Erin Beattie. I'm an academic family physician in Kingston, Ontario, and I have a master's degree in community health and epidemiology. Over to you, Sarah.
Okay. Hi, guys. So yes, welcome and thanks for watching. So my name's Dr. Sarah Lee. I, am a family physician and also have a master's in community health and epidemiology. And that is how Dr. Beattie and I met.
I
Many
make her call me Dr. Beattie.
Dr. Beattie. Yeah. And so how this event came about is that Erin and I both feel very strongly about, I think, dissemination of appropriate information. So making sure people get accurate information in a format that's really easy to understand and digest. And Erin and I have a few other things going on outside of medicine. And so we've become quite adept at doing these video chats. And we thought, well, why not do one about coronavirus? So, so basically we're going to run through, we're going to do a little bit of introduction about what we understand. And then we put together some do's and don'ts that are hopefully some short snappers and take home points. And then after this, we'll probably post a bit of information on the event page, as well as this video to go back to. So you have to dash away. That's okay. This will all be available for you. So we wanted to start, and I'm going to be looking away because I have notes. We wanted to start basically by like defining a pandemic and making sure everyone understands the sort of magnitude of what is happening right now. So you may hear different words: outbreak, epidemic, pandemic. So an outbreak is when there's sudden big surge in new cases of a specific disease. So we're seeing small outbreaks of coronavirus in different communities, specifically in Ontario, where Erin's located, and BC, where I'm located as well. An epidemic is when we see sort of a larger distribution of outbreak of cases, and a pandemic is a global outbreak of disease. So this happens typically when a new virus emerges and people aren't that immune to it. And so it spreads rapidly because there's no pre-existing immunity, and it just sort of goes worldwide. And that's what we're seeing right now. And this is probably the largest pandemic since the flu influenza pandemic of 1918.
Yeah, so the Spanish flu, yeah. So we haven't had a global pandemic since 1918, although the WHO has classified HIV as a global pandemic actually, but this is a little bit different because it's sort of taking the world by storm right now for sure. So I think, first of all, there's a lot of misconceptions about coronavirus and about COVID-19 really quick that I wanted to clear up. So number one, you might have heard out there, oh, you know what, coronavirus is just a cold virus, don't worry about it. So there is a little nugget of truth to that. So yes, coronaviruses are viruses that can cause colds. That is true. A lot of you have probably heard of SARS, right? So that was in 2003, which was another respiratory illness that caused outbreaks throughout the world. That was also a coronavirus, actually. But the difference with this coronavirus is it's a novel coronavirus, meaning that we have not seen this strain of coronavirus ever before in the world. It's actually thought that it began in animals and then was transmitted to humans, probably through ingestion of an animal that had the virus. So what's troubling about this strain is how rapidly it is spreading. And again, like Sarah said, that's probably due to the fact that it's novel. We have no immunity to it. Nobody really does. So, in epidemiology, we talk about the amount or how quickly a virus can infect 1,000 people as a measure of how virulent it is. So for SARS, it took SARS 130 days to infect 1,000 people, and it took COVID-19 48 days. So you can see, and again, that's probably because there's just really no immunity to this. It's a brand new virus out there. So it is rapidly infecting people. People have asked about a vaccine and what is going on there. Of course, vaccine development is in the works for this strain of coronavirus. But what I heard from our local infectious diseases expert is that it's probably about 12 months until a viable vaccine is available.
Yeah. So I think those are really important points to understand. It's just how infectious, or virulent is another word that we use in medicine to describe the capacity of this virus to infect people. So how it does that is through droplets. So you cough, you sneeze, you touch a mucosal membrane, and those droplets can either be spread onto another person or onto your hand, and then you touch these 3 body parts, which we're telling you to avoid touching. And then people have this short incubation period, which we think is anywhere from 5 to possibly 14 days. And then you start to show symptoms. The most common symptoms that we're seeing are fever and cough. So about 83% of people have reported a fever, and about 82% of people have reported cough. So think of those in the back of your mind. If you start to have either one of those symptoms, you need to think about coronavirus. But you also need to think 20% of people do not have those. So if you have other flu-like symptoms, which we call myalgias, which are muscle aches, joint aches, shortness of breath significantly, then you need to think coronavirus in the back of your mind. A lot of people can be asymptomatic. So meaning partially can be mild, like Erin was saying. And for sort of unknown reasons yet, children are often asymptomatic. Or mildly symptomatic, and we don't realize they have it. So they may have a cough here, a sneeze there, and they're still spreading the virus, even though we don't even know they have it. That is why we need to do social isolation, and we'll talk more about that later. So what's scary about that is that the cough and the shortness of breath, which can progress into a really serious infection requiring hospitalization. So right now we think about 7 to 10% of people with known cases, and this sort of fluctuates. And we have to take everything we know about the actual number of cases with a grain of salt, because testing is really limited for this right now. But we think at least 7 to 10% of known cases require hospitalization, access to oxygen, sometimes even ventilation in an ICU.
Yeah, so this is a tough thing, right? And I know everybody is fixated on numbers, and we're going to talk a little bit about why fixating on numbers isn't maybe the best thing to do. But right now, this number of 7 to 10% needing, hospitalization or critical care, keep in mind that the denominator of that is the number of cases that we know about. When in actual fact, like Sarah said, kids, for example, or people with mild symptoms who never got tested, who are still infected with the virus, they're not included in that denominator. So that number of 7 to 10% might actually be lower when you think about the actual number of people who are probably infected over the world who never sought care. So I want to give a little update for the people in Ontario who are listening. So as of today, Ontario had 137 confirmed cases, which is the most in the country, which is not surprising given that we are the most populous province. There's approximately 8,500 tests that have been done in Ontario so far. There's about 1,300 people who are still under investigation. So I am absolutely predicting and anticipating that those numbers will be higher tomorrow. So that means that we are on the upswing of the curve that you've been hearing about. So I know you've all been hearing about this flatten the curve. And Sarah doesn't know this, but
yeah, you did.
I've drawn, I've done some very good drawing for all of you. So you can see here, this is time.
That's
and these are cases. And so, along here, not many cases. The first case in Ontario was reported in sort of late January. So we were here. So now, though, we're seeing this, we're starting to go on the upswing. The dashed line that I've drawn there represents our ability of the healthcare system to look after everybody with coronavirus. So we're about here with the star. So you know what? We're doing okay. This is bad. So that's bad, right? You can all see that if we continue the way things are going, with the rate going up the way they are, we're going to overwhelm our healthcare system. And that's what we really want to avoid, right? Most of you who get coronavirus will be just fine. But a lot of people won't be, people who are in our vulnerable populations, which again, we'll outline those. And those are the people that we need to protect. So flatten the curve.
Yes, girl.
This is our trending hashtag, flatten the curve. What we want to do is we're on that upswing, but we want to make this curve not peaked like that. We want to flatten it. which actually means we know we're headed for an outbreak. So I hope none of you are surprised when that happens and the cases are growing and growing. It's going to happen, and that's okay to a point. What we want to do is spread that outbreak out over months and months and months and months. So honestly, 12 to 18 months would be perfect.
Ideal.
We could handle it. So you can see, look at, in my curve, look at the healthcare system's doing okay.
Yeah.
It's doing just fine. And so that's what we want to do. And so Sarah's going to give a little BC update. And then we're going to go into
We are. And I will add, Erin is absolutely right. There is an outbreak. It's going to happen. And it's projected that this pandemic won't stop until upwards of 70% of the world's population has been infected. So we know it's going to happen. It's going to spread. But what we need to do is spread it over time. Like the lovely Dr. Beattie just showed us.
Yeah. Okay. The 70%, sorry, Sarah, that's a concept of herd immunity, which some of you might have heard of in relation to vaccines, that we need a certain percentage of the population who are immune to something, and that actually protects the rest of us. So, and you can imagine this. So once 70% of people have gotten this, and nobody's sort of sitting there not immune to it anymore, it's just so much harder for the virus to spread. And so that's why things are going to slow down after more people get infected. Once you get infected, your immune system will create antibodies to this particular strain of coronavirus, and that way the spread will slow.
Hashtag science.
Oh, wow, you know it.
Okay, so I'm just going to give a quick BC update. Now, to the best of my knowledge, as of right now, we haven't had an update for today. So as of yesterday and including today, we've got 73 cases in BC. So it's the second highest number in the country. We have one person who has died, and that was an unfortunate, and that was in a long-term care home. And we have about 6 people who have fully recovered. And that's indicated by resolution of symptoms, so no longer feeling unwell. And they actually do 2 tests 24 hours apart to confirm that they have cleared the virus. We've tested we've tested 603,026 people as of March 13th, 2020. And we'll get another update tomorrow. And like Erin said, we are on that upslope. So I suspect these numbers are going to continue to rise. Nationwide, as of 3:20 p.m. today, to be accurate, we have 313 Canadians diagnosed with coronavirus in Canada.
Mm-hmm. Yeah, and I think, for all of you who are wondering where we're getting this information, I'm getting it from the Ontario government website. It's updated daily, and you can actually scroll down to see where the cases are and if they've done contact tracing, or if they've done, looking at if people have traveled or not. In Ontario, the last time I checked, there was 1 person who was hospitalized in the Niagara region, and the rest were all self-isolating. Like Sarah said, we've had 1 death in Canada so far, which was out in BC. Before we get into the do's and don'ts, I heard a quote online today that really, really resonated with me in terms of social isolating, and social distancing, because I think Canadians are sort of starting to get it, but there's some people who aren't, which was, our grandparents were called to war. You are being called to sit on your couch. So I don't understand what's so hard about that.
100%.
Yeah, we're very, very lucky. We're pretty coddled in this day and age. And if all we have to do to save lives is sit around and watch a bit more Netflix, I really don't see what's so hard about that.
100%.
Yeah.
And I'm gonna lean in on that a little bit more and peel that back and start with our first. Right? Peel that back. So we're gonna start with our first.
Like, I unpacked my clothes that I didn't take to Mexico because I'm already packed because I'm that organized.
I know you are. Oh my gosh. So we're gonna start to go through our do's and don'ts now. And our first do is socially isolate. Okay. Just start distancing yourself and start doing it now. Start doing it yesterday. So what does that mean? It means act like everything is closed and that the life of the people that you love depend on it, because it absolutely does. You can't attend baby parties. You can't go to church. You can't do big play dates. Don't go to the movies. Don't go to the gym. Work out at home. Have you heard of YouTube? Thank the Lord I got a Peloton, right, girl?
Yes, girl.
Right? If you have to go out, and some of us do, Erin and I have to go to work. My husband's also a physician. Stay 2 meters away from people. And Don't wear a mask if you ain't sick,
Mm.
right? Um, we have to do this now. Erin just showed you that beautiful graphic. We are
Oh,
on the
yes, that
upswing.
it is. That took me a long time. Thank you
Yeah,
for bringing that up.
and it was skillful. But we are on the upswing, right? Our numbers are rising. We need to socially isolate, and we need to do it yesterday. According to Dr. Teresa Tam, who spoke today, she's Canada's Chief Public Health Officer. She says our window to flatten the curve of this epidemic here in Canada is narrow. Okay,
Hmm.
guys, this is serious. Stay the home.
Yeah, yeah. Yeah, it's true. Like you guys are probably seeing or reading accounts of what's happening in Italy and Spain now, who's really taking off too. So, I mean, 2 weeks ago, they had the same amount of numbers that we did. And I think we've really been given a gift by being able
Yeah.
to see and learn from them. And we just really can't squander it. I wore a themed t-shirt tonight. If
Yes.
you guys are wondering if you should go out and do any activity, you should take a
Hashtag hard pass.
hard pass. You should take a hard pass. And if you do go out and you are within 2 meters of somebody, guess what? You are not socially distancing yourself. So, really what we're doing, how this looks practically for our family is we're not inviting anybody into our home. So no play dates for the kids, even neighborhood kids who we know really well. We've canceled our cleaning lady. So she's not coming. We're not the only places literally we are going. I know Sarah's laughing at me. She's like, clean your own house. Um, sacrifices.
I know.
Hash.
I'm horrified that you had to do that for you. It is a huge sacrifice.
I know. The only places we're going, honestly, is a grocery store only when we need to. And that's it. We today for our outside activity, we took a walk around our neighborhood, and that's it. Like we're not going to the mall, we're not going to parties, we're not going to any activities around the city. We've pulled our kids from any activities. Luckily, Ontario closed their schools. If they didn't, I was ready to keep my kids home.
Which I have done. Mm-hmm.
Yeah, exactly. Yeah. So it's serious. We need to do this, and we need to do this in big numbers. And you know what? I don't know how long we're going to need to do this for. This is probably going to go on for a long time. I'd be surprised if Ontario opened the schools after the 2 weeks after March break. We'll see. Okay, I have another do for you guys. This is some brand new information. So you do self-isolate after any travel outside of Canada. So until I think today or yesterday, it was that you had to self-isolate if you developed symptoms after travel outside of Canada. And even before that, it was only if you had traveled to certain countries of interest, China, Italy, Iran, Japan, Korea. Now it's any travel. That's even, yes, like if you live on a border city and you cross a border to go and get gas, you're going to have to self-isolate for 14 days when you get back. So don't do that. So this is a new recommendation. It was put out by the Government of Canada. It's on the Government of Canada website under travel advisories. If you have traveled and you're home now, you need to self-isolate. And self-isolate is different than social distancing. Mm-hmm. Self-isolate is you are in your home and you do not leave. So it's very strict, right? So you are not the exception to the rule. You can't just pop out for whatever. You need to stay home. It's critical that you observe the full 14 days. And once again, that's about the incubation period of this virus and what we know about that. It's the incubation period is about 5 days, meaning you could have this virus and be shedding it without symptoms for 5 days, but it can be as long as 14 to 21 days. So that's the reasoning behind 14 days. It doesn't matter if you have symptoms or not. So some people have been asking us about, well, what about household contact? So I traveled to Florida. My husband and kids didn't travel. I'm home now. What do I do? This is a tough one. There's no strict guidelines. I would say use common sense. If it was me and I got home and I had to self-isolate, I would probably honestly go up to my bedroom. I would stay away from my husband and kids. I would tell them to be very careful about their movements. I would sanitize my house like crazy. I would use a separate washroom for my husband and kids. So there's no guidelines to guide us there, but I would be very careful about that.
I would agree with that. And that sort of feeds into our next do, which is wash your hands
Yeah.
often. With soap and water is the best. Longer than 10 seconds. There's tons of like memes on there. There's some website you can go to and like create like a song, to go along with the hand washing. But do it often. Any new encounter, every time you come in from your house, or with hand sanitizer. And the caveat to hand sanitizer, it has to be at least 60% alcohol, isopropyl alcohol. And you can make your own. There's tons of recipes online. But there's places that are literally selling out. Like my mom lives in Whistler and she's trying to make it and she can't buy aloe vera gel.
Yeah.
But soap and water works just fine, right? So if you don't have hands, we barely have any hand sanitizer. We just wash our hands and frequently moisturize. And then consider cleaning off like frequently touched surfaces like your cell phone.
Disgusting. Yeah.
Disinfect these with disinfecting wipes, doorknobs, bathroom doors, faucets, toilet handles, all that kind of stuff.
What I will say, it's next to impossible to get Lysol wipes or hand sanitizer. But one thing that we actually ordered on Amazon a few days ago that I don't think the general public is wise to is something called Cavilon wipes or Cavi wipes.
Yes.
Avilon. We use them at work. It actually says right on the bottle that it kills human coronavirus. So check it out on Amazon. And
she furiously writes.
Oh yeah, get on it. Because they still had that in stock actually, and so those are really good wipes. I've been wiping down my phone, my steering wheel in my car, just really disinfecting like crazy. So Cavi wipes, I think at last check were still available. So maybe try those.
I'm gonna go on Amazon for a minute here.
Yeah. Sarah's like, the meeting's done. Get me some of those. Yeah, I know. I have no affiliation with the company that makes Cavi wipes, I promise. Okay. Our next do for coronavirus is I'm begging you to please think of vulnerable populations. So these are elderly populations, so people in general over 70 and people with health conditions. So I'm going to make a bold statement here, Sarah.
Yeah, I'm ready for it.
Are you ready?
Yeah, I respect you.
Okay. So I feel like this is a safe place. But if you're willingly going out right now and ignoring the advice of experts, of physicians, of public health experts, and you're not socially isolating if you're unwell or if you traveled, or you're not observing social distancing and you're like, I'm still going to go to that birthday party, or like, I'm going to go to Indigo and touch a bunch of books and then go to Winners. And by the way, 3 weeks ago, that was my life. So I understand that you want to do that. You're willingly putting those people at risk. And I don't know how you would ever justify that to yourself. And what I'm asking all of you watching, because I know the people watching here are the ones who are engaged with social isolation and social distancing. You need to spread this message, because my social network and Sarah's social network only reaches so far. We are absolutely relying on you guys to spread this in a very loud and very clear message. And you know what? One way to think about it too, I hope I never see another global pandemic in my life. But if I do, I might be the vulnerable population. I might be the elderly person, and you might all be too, that require protection. So do it for them. It might be you someday.
Yeah, 100%. I think that what we're asking people to do is easy, but it's also hard, right? It's scary. And so I think another do that we've got on our list is talk to people about this. Talk to your friends how you're feeling over the phone, over FaceTime, over Zoom, not face to face, or go for a walk in the woods 2 meters apart. But this is really stressful for everyone. And we need to be here for each other, now more than ever. So I think it's important for us to acknowledge that, especially for, spouses. It's going to be really straining, right? Especially for those of us who have young children, and we have to keep them in our house, right? There's tons of ideas out there, about what to do, activities, how to talk to your kids. But I think we need to keep a really open dialogue and be mindful of how stressful and anxiety invoking this is for everyone.
Yeah. But I mean, also if you don't want to do the color-coded daily schedule with curriculum and all your kids do for the next 2 or 3 weeks is watch a screen, good for you.
That's okay.
Like, you do that, put
Mhm.
on whatever,
Mhm.
and just keep him in the house. Like, honestly, right?
Yep.
Am
Screen
I
time recommendations do not apply.
Yeah, that's right. As many screens going as possible.
Yeah.
Um, but yeah, no, it is very stressful. I was actually texting with some of my physician friends and in a group text, and I just said, you know what, guys, over the next couple of months, we all just can't go crazy at the same time. So there has to be at least one or two of us
Yeah.
who's okay. But that's what I plan to do because it's stressful and overwhelming for healthcare workers too. And for sure, I've been reaching out like crazy. So I encourage you guys to do that too. You're not alone. Everybody out there pretty much is feeling the weight
Mhm.
of this, I think.
Mhm. Mhm. I agree.
Yes. And so another do, sort of moving right along, what to do if you get sick. I think there's a lot of questions, there's a lot of
Mhm.
confusion about this. What do I do if I start getting symptoms that seem like it might be the coronavirus? If they are mild to moderate, stay home. You can call your local public health unit for any directions about testing. But I can tell you that in Kingston, at least, the how we define a case or a case definition, which essentially means who are we worried about enough to actually swab, has recently changed, and that's because the actual swabs for COVID-19 are not in huge numbers here in
Mhm.
Ontario. We don't have many of them. We
Yeah.
really have to reserve them for the people who we think are at really high risk of getting sick from COVID-19. So basically, right now, we're really just focusing on swabbing people who are high risk, people who have traveled and are showing symptoms, or people who are a close contact of somebody who's known to have COVID-19 or who is a probable case.
Mhm.
And we also are giving special consideration to swabbing healthcare workers, obviously, because if we are shedding the virus, that's potentially disastrous.
Mhm.
Um, so I would say, don't overthink it. If you're sick, first of all, and your symptoms are mild to moderate, please just immediately self isolate. So we've talked about what that means. So go ahead and do that yourself. If you want further direction, just call your local public
Mhm.
health unit and they can direct you from there.
Yeah.
In Kingston and in many cities over around the country too, there are COVID assessment centers set up to divert patients from the family doctor's office and from the emerge, which are already overwhelmed
Mhm.
with all non-COVID related things. So please just call public health. Don't leave your home if you get sick with symptoms suggestive of COVID. Just stay there, mild to moderate. You probably won't need any special care at all.
Yeah, and it's the exact same here in BC in terms of who we're testing. So I think the rest of the provinces are all probably similar. And one thing I would add, and I suspect this is the same in Ontario, is in terms of Erin and I are both family physicians, so we do work in an office-based setting, and a lot of us are doing mostly telephone visits and telehealth now. So if you are concerned you can't get through to public health, you can always book a telehealth or a phone appointment with your physician if you have a family physician.
Yeah, that's a really good point. So, if any of you out there have, appointments booked with your family doctor, it's really worth calling to ask if that appointment is still on. I know at the Queen's Family Health Team where I work, we are moving to almost entirely virtual appointments starting tomorrow. And once again, that's to save you guys from coming out into public when you don't need to, and that's also to protect us. Healthcare workers, we are at very high risk of contracting coronavirus. And the problem is when we have to self isolate for 14 days too. And you can probably figure out if we dwindle in numbers, there's going to be not many people left to look after the people who are sick. So we have to stay well to look after you guys too.
Mhm. Yeah.
Okay, well, we're moving on to the don'ts.
Yeah.
Don'ts.
Yeah.
Those are the do's. Let's talk
Yeah.
about some
Okay.
don'ts.
I got the first don't is easy.
Yes,
Don't travel anywhere.
anywhere,
Anywhere.
anywhere,
Don't
anywhere.
go down the road. I don't go to a neighboring city. Do not
Yeah.
take the ferry. I live on an island. Stop taking the ferry. Don't fly anywhere. Don't travel.
Yeah.
We're done. We're done with
Yeah.
travel.
We're done with travel. Nowhere is safe, really. It's not like honestly, the safest place is your home. And so I like anywhere really. Like I'm not planning on going anywhere but from my home and directly to work, and that is it. So don't even travel within your province. Don't travel. Don't even consider any travel. I mean, you know that the government of Canada recently said, don't travel anywhere. Basically, it's strongly advised. We'll see if it'll become an actual ban. It's not yet, and so technically you could, but like take a
hard pass.
The hardest pass you've ever taken in your life should be on traveling,
Yeah.
right?
Yeah.
And you know what? That's probably going to be for a long time.
Yeah. Yeah. I mean, they've already, okay. So guys, this is how, so I've had to cancel 3 vacations this year. So don't feel bad for me. Cause yes, I had 3 vacations scheduled. Yeah. And that's okay. Right. We're so privileged. Everyone in this country, and we'll travel again when this is over.
Yeah, that's right. Yeah. There's so much bigger issues at play and so many things that are so much more important than my vacation that I had to cancel to Mexico. It's okay. I will rebook it for sure because I love that place. But it is not the right time at all. No trouble. Sarah, I think you'd agree that's an easy don't.
Oh yeah, 100%.
That's the easiest don't.
That's the easiest. Yeah.
Because the next don't I have, I think, is actually not that easy at all.
Yeah.
I'm going to challenge all of you to not fixate on numbers. So we all have been looking at the numbers and how many cases per day. And I know I just told you guys that a little bit ago. But the problem is when you look at numbers and you see them rising, that can make you really anxious and maybe even feel panicky and feel out of control. Don't fixate on the numbers. And Sarah and I have told you this is coming. The numbers are going to rise. Don't be surprised by that. Focus on what you can do. And we've talked about what you can do, which is socially distance and socially isolate. So just do not focus on the numbers. There's projections out there, and I know they're terrifying and really scary about, you're probably all well aware. And my husband, Steve, like in the past week has gotten like a diploma in public health practically.
Yeah.
You're probably all aware, basically about the fact that Canada has X number of ICU beds and what if. It's scary, right? To focus on those numbers. I feel it too. And what I do is I forget about the numbers for now and I focus on what I can do. And the fact that I can, we live in an age of social media where we can spread messages like wildfire. And so I am all challenging you today to spread this message of social distancing and social isolation.
Yeah.
Don't focus so much on the numbers. You'll just get really freaked out.
Yeah. I couldn't agree more. I think that another really important don't, moving on because I'm being mindful of time here, is don't go to the hospital if you get sick. Do not go to the emergency room, especially with mild to moderate symptoms. They are already, so here in BC, and I suspect it's the same in Ontario, our hospitals basically work at max capacity anyways. We already have patients in the hallway. We're already dealing with all the non-COVID. If you have mild to moderate symptoms, stay at home, call public health, book a telehealth appointment with your doctor. If you have shortness of breath, 100% you need to be assessed. If you're having trouble breathing, if you're seriously unwell, if you're dehydrated, you need an assessment, and that's a different story. But if you have mild to moderate symptoms, do not go to the emergency room.
Yeah, exactly. Take a hard pass on the emergency room. I don't know. Is this joke still good, Sarah?
Oh, it's never going to get old, Erin. Not tonight, anyways.
Yeah, that's right. Okay. Yes, I totally agree. So avoid the emerge, please. They're going to be overwhelmed. I mean, people are still going to have their heart attacks and still going to have their strokes and their traumas and stuff in the middle of this pandemic. So my lovely emerge colleagues, please, please, please give them a break. But if you're worried, phone telehealth, phone public health, phone your family doctor's office. We can talk you through it. Okay, my next don't. Oh my gosh, this is a tough one in this day and age, but please don't get lost in social media. Like, how many of you, I know we have your audio and your face is muted, which is too bad, but I like put your hand up at home alone if you have spent too much time on social media in the past 5 days, and there's been times where you feel like, oh my God, like I am going to lose my mind because I've just read 5 articles about how, what's going on in Italy and I'm really freaked out and and I can't stop thinking about it or talking about it. Who has thought about that? Put your Sarah.
Oh, sorry, sorry, I'm trying to figure out someone's videos on it. I was trying to. Oh,
oh well, put your hand up. Put your hand up. Yes.
Hand up. Okay. Well, there we go.
I know. But it was Zachary.
Somebody actually can, like, somebody's raising their hand virtually. So clearly someone's Zoom.
Oh, that's great. Oh, somebody's really, we know nothing about Zoom. We're actually surprised we made this happen. Go us.
Yeah.
So it's like social media will always be a dark place for medical information. And I tell my patients this, even when it's not a global pandemic, but as a physician, the stuff I've been reading, some of it is just flat out wrong. And it's been nice. I've actually had quite a few people message me to say, what do you think about this? Is this a reasonable thing to be worried about, or should I really be doing this? Which is great. I always encourage you, if you read something that seems off, definitely talk to somebody who you think might have some reasonable information or knowledge about that. But take breaks. Like what I've been doing is, a bit of social media in the morning and staying away from it, so this is what I do anyway, and Sarah can weigh in too, but so take breaks, have dedicated times where you have, you'll delve into social media. I like to read books. I highly recommend anything by David Sedaris because he's hilarious. Meditate. There's good meditation apps. Exercise at home. Take a walk. Talk to somebody if you're feeling really stressed out. But please, please, please just be very, very cautious about social media. I find it to be very alarmist, very panic-inducing right now. So just be careful about what you're ingesting online.
Yeah. And I couldn't agree more. And for those of you who got the link through our She Found Health page, that's a big impetus about why we created this community, is to share reliable information. And so after this, what we'll do is we'll post some links to some reliable sources. There's great reliable resources out there for us here in BC, the BC CDC, Public Health Agency of Canada, the WHO. There's tons of great reliable sources of information if you need to get them. But like Erin said, ask your doctor where to go for the information. If you need to access it, for the most part, I feel like we have covered everything you need to know about coronavirus tonight. And so I agree. I try not to get on there too much. I actually have an app called Moment, which tracks your screen time, right? Yeah. So I think that's a really valuable thing to be doing right now. Like read a book, like binge on some Netflix, journal, go for a walk, exercise, Steve Sung. Yeah.
Yes, Steve Sung.
Yeah.
But
do social media. Yeah.
Yeah. But just be careful. Like social media, it does connect us, but I find it can sometimes make you feel really awful. So let's all commit to doing less of that, shall we?
Yeah.
Yes. Okay. And then we're leading into our last don't, actually.
Yeah. Okay. This is a big one, guys. Do not underestimate your role in fighting this pandemic. We, as physicians, we need you to stay home. We, as a society, as a country, as a province, as a city, we need to stay home. We need to stay well so we can protect you. And we also need the resources to be available when people get sick. I listened to one of our intensivists, so an ICU physician, do grand rounds, and he said, medicine cannot stop this. Only public health can stop this. I heard this quote today that Dr.
I love a good quote.
I know, right? Oh, I know you got another one, a good one coming.
I did.
So I heard this one today when I was listening to Reuters News. And Dr. Anthony Fauci, I think is his name. He's the head of the U.S. National Institute of Allergy and Infectious Disease. And he said, when it comes to this pandemic, if it looks like you're overreacting, you're probably doing the right thing.
Yeah. Yeah, I heard a similar quote. This is not the quote I'm finishing with, which is a heavy hitter, but I heard a similar one that basically said, if everybody looks like an alarmist before a pandemic, and then afterwards everybody looks like they didn't do enough or something. I just butchered it. Steve, inadequate. Everyone looks inadequate after.
Yeah.
Steve's just opening the freezer and making some meatballs. Maybe just...
We got 2 minutes, Steve. 2 minutes.
Yeah. Okay. So anyway, I take a hard pass on Steve making meatballs. All right, so what I'm going to finish with, but yes, I want you guys all to know that we as physicians are literally relying on you so much, and we need you so much, and we need you guys to spread this message so much. And I literally thank you from the bottom of my heart for doing that, because I need you guys to keep me safe. I don't want to get sick. I mean, it's a high chance that both Sarah and I will become infected with this because we are going to be exposed to it. But we need you guys to help and help the physicians in your community by, number one, not going out when you don't need to and not spreading this, not going to the emerge when you don't need to and infecting a healthcare worker. Just please, 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 and thank you very much. And I'm going to finish. So when I think about world leaders and people who are really there for people in trying times, you know who I think of? I think of Winston Churchill. Steve's laughing at me, and I don't know why, because who doesn't think of Churchill? So some of you, I mean, probably all of you know, he was Britain's prime minister during the Second World War, and he had this really famous speech. And I want to end with a quote that he said during war times. And I know it's not war times, but as a physician on the front lines, I feel like I'm about to go into battle against this virus. And I'm sure Sarah does too. And I know my other frontline workers, physicians, nurses, respiratory therapists, you know, my secretaries at the Queen's Family.
Oh, yeah.
Everybody, you know, the people who are cleaning the rooms, every single person who has to go to work, we all feel like this. So I'm going to end with a quote from Churchill. And he said in a famous speech in 1940, you ask, what is our aim? I can answer in one word: victory. Victory at all costs. Victory in spite of terror. Victory, however long and hard the road may be, for without victory, there is no survival.
It's powerful. Yeah.
Well, he always brought the heat.
He sure did. So that's all we have, guys. I know a lot of you had asked questions about pregnancy and breastfeeding and young kids. I'm actually going to do a separate post video, probably all about that, because we realized we had a lot of just basic content that we thought was really important to get out there. So that video will be coming. We will post this and it'll be available. I'll put it on my regular Facebook page. I suspect Erin will as well. Thanks for your attention. And we ask you, spread the message.
Spread the word, not the virus.
Yeah. Okay. Bye, everyone.
Bye.